Okay, we've gone through a couple of exercises. This one is called the seated shoulder flexion slide at tabletop. Again, this is a list of physical therapy exercises that you'll get from your doctor or your surgeon. And my purpose here is to just tell you what I'm doing and how it feels so that you'll know what to expect. Now, our surgeries are all different. I'm just going to recap again. I had a torn bicep tendon that was relocated. I had a calcium buildup that was removed and the rotator cuff muscles sewn back together. And I had the clavicle scraped or shaved, as they said, so I had more range of motion, more space of movement in the shoulder. These exercises, that happened, the surgery was a week ago, tremendous pain, but I feel like I'm making really good progress, so you can get through this. This is probably the most painful of the exercises that they've given me to do at home. The tabletop slide, first off, you'll see that I have this white powder here. It is legal, it's not illegal powder. This cornstarch. And what I've done is spread the cornstarch around so that I can more easily slide my arm on the table. So it's going to be messy, but I just leave this set up all the time. My arm is resting on the table right now. I can feel the blood flow, it's feeling pretty good. And I'm going to lift my arm and get it onto the table, like so. Keeping it in neutral, thumb up, that's neutral, forearm in front of me. And I'm going to slide my arm as I lean down. I'm going to have my body push my arm away from me, stretch it out, hold it for a couple of seconds, and then pull it back. The goal here is to do 5 to 10 reps. 2 sets each, 3 times a day is what I've been instructed. Check with your doctor to make sure you're doing it right, and you should be doing this at all. When I do this exercise, it's going to really hurt all the way across my shoulder, all 3 of those areas, the bicep, the rotator, and the clavicle area. They're all going to hurt. The problem is when I start this exercise, I'm really tight. So for me, what I have done is the first 2 times, I'm using my arm to slowly help slide it out there, keeping my breathing under control and getting the initial stretch, so then I can do it on my own as I near the end of the repetitions. So bear with me. I'm going to try and do just 3 of them, control my breathing while I do it, and then I'll talk a little bit more about what I'm feeling. Each time, I'm going to go a little bit farther and a little bit lower, and I think you'll be surprised how far I'm going to be going on this after I go through one whole session. A lot of pain there, but it's manageable. It's manageable. Hold it. Slowly bring it back up. You can just feel it pulling those tendons. A lot of pain coming up across the top of the shoulder there. Pain subsiding. I know I'm getting a good stretch in. Pain coming down this side. I'm getting it on all sides. Okay. Hold it and pull. Straighten back up. Oh. This one is a doozy. Feels like it's just pulling your arm just right out of socket, and it probably is to some degree. Okay, 4. Back, 5. There's one more. You can see how much farther I'm stretching, getting a lot of pain coming down the back of my shoulder there, back of my arm, all the way down to my bicep. This is the one that I do last because after this baby, I'm ready for some ice. And this is 5. Okay, hold it. You can see how much farther I'm stretching. Pull it back. Nothing that's beyond what I can handle. I'm pushing about a 4 or 5, maybe even a 0.6. Definitely painful than the other ones, much more painful. But I know I'm getting a good stretch. Now I'm just going to relax for a second. Catch my breath. Get a little more powder over here. And do it again. Now keep in mind, after I had my surgery, right afterwards, they had to keep me in the hospital because I passed out twice just from the pain of the surgery. And now look how I'm moving my arm. One more set. See, no assistance. Getting a good stretch in there. Oh, baby. Bringing it back. As I go through these exercises for the next couple of weeks, that hurts right at the back of the shoulder, probably where they put the camera in. My wife said I had a hole back there somewhere. As I do these exercises for the next few weeks, I want you to follow along with me so that you can see each step of the way how we're progressing and the level of pain and what you can expect. When I first started this one, I did not think I could do it at all. It took the first couple of times to help with my left hand to get my right arm going, but now look at how we're doing. Getting a good stretch in there. Good stretch. Hold it for 3, 4. Pull it back, keeping the arm in neutral. And we're going to do one more. Just as I get to the top, I feel that pain at the very back of my shoulder. Going down, 5, not bad, no pain, feeling good. Right there, starting to get some pain down my bicep, all the way down to my fingers. Keep the breathing going, hold it, and bring it back up. So what I'll do at this point is, besides pass out, what I'll do is just clean my arm off, get all the powder off. I usually get a warm washcloth and wipe it down. It feels really good. Put a little ointment back on it and get it back in the sling. And then I'm going to put some ice on it. I'm taking the pain pill before I do the exercise and then putting ice on it afterwards so I can help cut back on my pain meds. I'm taking less than half right now of what I'm supposed to. So that's where we're at. You can do this. That first couple of slides, it's tough. Just manage through it, get it up to a 4 or 5 on the pain scale, stretch it out, and before you know it, you'll be doing some really good slides and you'll be getting that shoulder loosened up. Until next time.